Well, good afternoon, everyone, and welcome to today's COVID-19 update briefing. 3 weeks ago, August 19th, stricter mitigations took effect in the Metro East region. And after 2 weeks of exceedingly high positivity rates, that region joined Region 7, Will and Kankakee counties, in operating under even stricter mitigations. While unfortunately Region 4, home to the Metro East, continues to see high rates of community spread with a 7-day rolling average of 10.1%. We've been pleased to see the beginning of a downward trend in Region 7. That's Will and Kankakee counties, and they have reduced their positivity rates with a current 7-day rolling average of 7.5%. As I've outlined, the region would face a 14-day minimum under those mitigations. If the positivity rate averaged equal to or less than a 6.5% average at that time, the region would return to Phase 4 mitigations under the Restore Illinois plan. At this time, the Region 7 positivity average falls between 6.5 and 8%, the window in which IDPH will continue to monitor the area. Assuming things continue in the right direction, Region 7 will stay put in its current mitigation status until the average falls below 6.5%. I'm hopeful that Region 7 might become a testament to the community's ability to turn this ship around in the right direction. If they keep up the good work, Region 7 will soon be restored to Phase 4 mitigations, which would mean higher indoor capacity limits for gatherings and businesses like restaurants and bars. Last week, I highlighted the trend over the previous 2 weeks that 9 of our 11 regions had seen increases in positivity rates. Well, I'm pleased to say that over the last 7 days, most of our regions have seen a slight decrease in their positivity rates, with only 3 seeing a statistically significant increase. Some have asked why action is required when positivity rates balloon to 8% or more. The answer is clear and straightforward. Dr. Anthony Fauci said it best. There will always be cases, he said, but how you prevent those blips of cases from becoming something that obviates the whole program, that's what you're preparing for. You can either close the bars or close the schools. We can't outrun this virus. It hasn't gone away. We can't pretend that we can fully restore our economic vitality as long as it's here without any way to temper or prevent it. Unless we get it under control either by people following the doctor's recommended mitigations or with an effective treatment or a vaccine, we will be fighting to save the Titanic with a plastic bucket. Because there's no national strategy, it's up to us, every individual and every city and every business in Illinois, to slow the rate of infection across this state. Wear a mask, watch your distance, don't exceed capacity limits, be kind to one another. We continue to closely monitor every region. So I want to emphasize again that local elected officials and health officials should pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of rising infections and positivity rates. That includes officials at higher education institutions. We're carefully watching the outbreaks that we've seen on college campuses the last 2 weeks. Since our last update, I've attended 2 memorial services, one in our capital city of Springfield and the other in Chicago, to honor the more than 8,400 individuals that Illinois has lost to the COVID-19 pandemic. And while each was a beautiful interfaith service, allowing us a moment to breathe and to grieve and to heal, each memorial also serves as a painful reminder of why we all need to do everything possible to prevent the spread of this terrible virus. Illinois You already know what it takes. Mask up, keep your distance, wash your hands, stay home if you're sick, get tested when you need. But I'll add one more thing that you can do to help out your loved ones, and that's get your flu shot. It's available in most places right now. It's not too early. In fact, now is the time to do it. And as we continue to battle the COVID-19 pandemic, getting your flu shot has never been more important. Before I turn over the podium, I want to remind everyone to fill out the 2020 census, the survey that determines how much funding Illinois gets from the federal government for schools and hospitals and roads and childcare and much more, as well as what our representation in Washington will look like. Just a 1% undercount could result in the state losing over $195 million in federal funds each year at a time when we need our full funding the most. Just like voting, getting counted in the census is an act of civic engagement, a demand to be fully heard and fully counted. So pick up your phone and go to my2020census.gov. my2020census.gov, or call 1-844-330-2020, 1-844-330-2020. Take the time to make sure that your voice is heard. So thank you, and with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezekiel. Doctor?
Thank you, Governor. I will start today by highlighting that September is Suicide Prevention Awareness Month. As of today, we don't have any conclusive data indicating that suicide rates have risen as a result of COVID-19, but we know many Illinoisans, I dare say every Illinoisan, has experienced impact on their mental and emotional well-being, and issues such as job loss, financial strain, and social isolation are all risk factors for suicide. If you or someone you know is in an emergency situation, please call the National Suicide Prevention Lifeline at 1-800-273-TALK, T-A-L-K, or 1-800-273-8255. Today, we are reporting 1,953 individuals who have been newly diagnosed with COVID-19 and 28 individuals who have sadly passed on. This brings the total number of individuals in Illinois to 255,643, and the total number of lives lost to 8,242. Overnight, we had 1,609 people in the hospital with COVID-19, and of those, 346 were in the ICU and 141 patients were on ventilators. In the last 24 hours, almost 49,000 lab results were resulted to bring our total testing number to 4,575,000. There is much we still need to learn about this virus. We're still learning if a person can be reinfected, and if so, after what time frame. We're still learning how much viral load is present before someone starts showing symptoms. We're still learning what medicines can be most effective to treat this virus. But there are things that we do know. We do know that pre-symptomatic and asymptomatic transmission are possible. Just for review, pre-symptomatic means the time before the development of a cough or shortness of breath or loss of taste. And asymptomatic means that someone who was infected but never developed a symptom throughout. Studies have shown that the viral load actually peaks in the days before any symptoms show. And we know that just general speaking is enough to expel droplets that carry the virus and could infect another. A medical article recently published entitled Face Masks Against COVID-19 states that the available evidence suggests that near universal adoption of non-medical masks when out in public in combination with complementary public health measures could successfully reduce effective R to below 1.0, which thereby would stop community spread. This means that if we all wear masks and keep our distance and wash our hands, we can help reduce that effective R. If you recall, that is the number that tells us how many people will be infected by that individual who does have the infection. This ultimately slows the spread of the virus to the point where it will actually stop circulating. Our effective R is currently just above 1. We're so close, so these additional steps will get us where we need to be. Models do suggest that public mask wearing is most effective at stopping spread of the virus when compliance is high. That means the vast majority of people need to be wearing the face covering. We've all got to do this together. In one simulation, researchers predicted that 80% of the population wearing masks could do as much or even more to reduce COVID spread than a lockdown. There may be some disagreements out there, but there are things that we can all agree on. We all want our kids in school. We all want our restaurants open. We all want all of our businesses open, and we can do that by wearing a mask. Wear a mask. There's power in your face covering. Collectively, we could save thousands of lives. And we could save millions of dollars when we think of the jobs saved, the businesses saved, the healthcare dollars saved. And don't forget the examples that we've already talked about where wearing a mask when actual infection was already in place and transmission did not occur. There was a man that flew from China to Toronto and subsequently tested positive for COVID-19. He was actually symptomatic on the plane. This is a 14-hour flight. He was subsequently diagnosed, and they went back to track the 25 people in the rows and seats closest to him. None of those 15 people tested positive for COVID-19 because he wore a mask for the entire time on the flight, and that was the policy on the plane. The other case that I told you about previously in May, where there were 2 hairstylists in a single salon who turned out to be COVID positive. They worked while symptomatic initially, and they had over 140 clients in the time that they were symptomatic, and not a single one of those clients that were tested came up positive. So what more can I tell you? How can we convince you further? Wear a mask. It's really that simple. The more people who practice these 3 W's, wearing a mask, watching the distance, and washing our hands, the sooner we can end this pandemic. And I know there's no disagreement on wanting to end this pandemic. Thank you. Quiero comenzar hoy recordando a todos que septiembre es el mes de la prevención del suicidio. No hay datos concluyentes que indiquen que las tasas de suicidio hayan aumentado como resultado del COVID-19. Sabemos que muchos residentes de Illinois tienen efectos en su mente y problemas con la pérdida del trabajo, la tensión financiera y el aislamiento social. Son todos factores de riesgo de suicidio. Si usted o alguien que conocen está en una emergencia, llame a la Línea Nacional de Prevención del Suicidio al 800-273-8255. Hoy informó 1,953 personas nuevas con COVID-19 y 28 personas que han muerto. En total, hay más de 255,000 personas con COVID-19 en Illinois y el número total de vidas perdidas son más de 8,200. Desde anoche, 1,609 personas en Illinois estaban en el hospital con COVID-19. De ellos, 346 pacientes estaban en la unidad de cuidado intensivos y 141 pacientes estaban en ventiladores. En las últimas 24 horas, más de 48,000 pruebas de COVID-19 fueron hechas. Todavía hay mucho que aprender sobre este virus. Todavía estamos aprendiendo si una persona puede volver a infectarse. También cuánta carga viral está presente antes de que alguien comienza a mostrar síntomas y qué medicamentos se pueden usar para tratar el virus y mucho más. Sin embargo, sabemos que tanto la transmisión presintomático como la asintomático son posibles. Los estudios han encontrado con la carga viral alcanza su punto máximo en los días antes de que aparezcan los síntomas. Y sabemos que hablando es suficiente para expulsar gotitas del virus. Un artículo afirma que la evidencia disponible sugiere que la adopción casi universal de máscaras cuando están en público, en combinación con medidas complementarias de salud pública, podría reducir con éxito el R efectivo por debajo de 1.0, lo que detiene la propagación. Lo que esto significa es que si todos usamos máscaras y mantenemos nuestra distancia, podemos ayudar a reducir el R efectivo. Eso es la cantidad de personas que pueden ser infectadas por un individuo que está infectado. En una simulación, los investigadores predijeron que el 8% de la población que usa máscaras haría más para reducir la propagación de COVID-19 que un orden de quedar en casa. Entonces, si quieren mantener abiertos los negocios, use una máscara. Si quieren mantener abiertas las escuelas, use una máscara. Si quieren mantener abiertos los restaurantes, use una máscara. Hay varios ejemplos en los que las personas tenían una máscara y no se produjo la transmisión del virus. Un hombre voló de China a Toronto y dio positivo por COVID-19. Tuvo tos seca y usó una máscara en el vuelo. Las 25 personas cerca de él en este vuelo dieron negativo en COVID-19. En otro caso, a fines de mayo, 2 estilistas de pelo en Missouri tuvieron contacto con 140 clientes cuando estaban enfermos con COVID-19. Todos llevaban una máscara y ninguno de los clientes dio positivo. Usar una máscara es realmente así de simple. La más gente que se cubran la cara y practiquen el distanciamiento social, más pronto acabamos con esta pandemia. Pero lo tenemos que hacer juntos. Sí se puede, Illinois. Gracias. And with that, I'll turn it over to Governor Pritzker.
Thanks very much, Dr. Ezekiel, and happy to take any questions from members of the media.
Governor, you know, there has been so much made about the college campuses. You
Yeah.
did say, you mentioned it slightly. Illinois State especially having a big problem.
Yes.
What guidance, what specific guidance are you giving them?
So I was there, as you may know, yesterday in Bloomington, and it's been extraordinarily important for colleges to stay on top of testing on a regular basis, and we're trying to provide the resources that are necessary for colleges to do that. I've been in touch with the leadership of Illinois State as well as U of I, where the saliva test has been very effective, and then as you know, we're working with U of I to expand the use of that saliva test on other campuses. I've also been in touch with Bradley University, where they've got a quarantine going on for all of their students for 2 weeks. So what's required here is testing, contact tracing. It's really all of wherever you see an outbreak. And that's what's happened on some of these campuses. You want to make sure that people are quarantined, you want to make sure that you're contact tracing, and you want to make sure that you're planning for people being isolated so that they're not giving it to each other in the dormitory, for example.
I think it should be emphasized that most of these people who are self-quarantined are asymptomatic. Some have no symptoms at all, and of the
Some.
35,000 college kids across the country, only 5 have been hospitalized.
So what's your point? You think that unless you've been hospitalized, it's
No,
not
I'm just
worth
saying-
worrying about?
No, I'm just saying, of all the college students in Illinois, how many are in the hospital? Do you know that number?
I don't know that number, but I mean, I think you're discounting the idea that getting COVID-19 is serious business. Making sure that someone who has COVID-19 is not spreading it to other people is the reason that you want to quarantine people. So that's critically important. I know there are lots of people who think, well, gee, somebody didn't have to go to the hospital or they didn't die and therefore, well, there's nothing to it. That's just not accurate. I realize that there are people, particularly followers of the president, who believe that that's true, that it's okay to spread COVID-19 because, hey, if you're not showing symptoms of it, then it's fine. Well, guess what? When people are not wearing masks, when people are just running around asymptomatic, right, and if they're not getting tested but they are positive, they're spreading it to other people, and the result is that it's going into environments in which people who are vulnerable are going to be sick and are going to go to the hospital. And by the way, you should take a look. Our hospitalizations in the state are rising. And this is problematic. So we're watching very closely, even though we've got our positivity rates moving in the right direction in many regions, that hasn't kept people from going to the hospital because, you know, someone who is more likely to end up in the hospital getting it versus somebody who is less likely to end up in the hospital, you just don't know because you don't know who's got a comorbidity. Everybody who knows they've got one, that's fine. You know you've got a comorbidity and you should take extra care. Many people don't know that they have a comorbidity yet, and then they get COVID-19, and then they end up with a problem.
What's the update on that saliva test being used other places? How soon?
Yeah. So to remind you, the saliva test was the result of a bridging from the lab at Yale. This is a complexity that maybe people aren't interested in, but FDA allows bridging between one lab and another, and that's essentially what happened between the Yale lab and the U of I lab. The U of I lab now has the ability to bridge the emergency use authorization to other labs, and so they're working with ISU, for example, to try to bridge to ISU. Meanwhile, there is also a challenge to ramp up the amount of equipment that's available for all the other campuses that are across the state of Illinois. Some have it. They have veterinary schools or medical schools where they can use equipment that's already in existence. Some don't. And so we want to make sure, though, that we are, have the equipment and have the ability to blow it out to all the campuses. But in short, we believe that this is going to, as I've said from the beginning, it will take probably 8 to 10 weeks before they're able to really get this to other major campuses all across the state of Illinois. From now, or from the time that we announced it, which I think is about 2 weeks ago. That's the belief was 8 to 10 weeks. You can't hold anybody to the schedule, though, because part of this is dependent on the FDA. And part of this is dependent upon, how efficacious the manufacturing of and the distribution of that equipment is.
The Chicagoland Apartment Association says that some renters are taking advantage of the grace period. Mm-hmm. They are asking you to amend the orders about no evictions and say that the governors of California and New York have done so and are more specific, so that people who can pay will and not use the no eviction as a crutch.
We're absolutely going to look at that. I think, let me remind you, our goal here is not to deprive landlords. In fact, if that were the case, we would have attempted to do what some people have called for, which is cancel rent. What we're trying to do is take into account both sides of this. We don't want mass homelessness, and that's what would occur if you simply removed the moratorium on evictions entirely. We also have, as you know, put in place one of the in fact, the largest in the nation, mortgage assistance and rental assistance program, $150 million in each of those. It's still not enough. We still need the federal government to step up and help us with this. And as you know, the CDC has put in a moratorium on evictions as well. But we're trying to balance interests here, and we'll continue to do that to make sure that, that each side, everybody is going to take a little bit of a hit here. But the biggest thing we don't want is for people to end up homeless in a mass pandemic.
So Governor Cuomo promised in-person learning. Their state kept their positivity rate below 2%.
Sure.
It's good news for the past 30 days. It's been below 1%.
Mm-hmm.
Is there a number that you could commit to right now so that we can strive for something? And for parents of us, a lot of us who have kids at home right now, e-learning, that we can look forward to or strive for? Is there a number?
Well, it's a lot lower than where we are now, and it's a long way to go. In fact, as you know, at our very lowest positivity, we were at about 2.6% across the state, which is a decent number, a pretty good number. The WHO and the CDC have said that below 5% is kind of something everybody should strive for. But with regard to what level at which we would just send every kid back to school, I don't know what that number should be, but we're a long way from it. So we'll certainly be looking at what number we ought to be looking at. And there's no region that's even close, though, to where New York is.
Is there an update on Mercy Hospital to save Mercy?
I can't give you an update today. I can tell you that this is what's important to me is to make sure that we've got health care available, on the south and west sides of Chicago and in communities that have been frankly historically disinvested from when it comes to health care. It is very challenging in this environment for hospitals. The federal government has provided direct assistance to hospitals. We've provided assistance, particularly to the safety net hospitals and critical access hospitals across the state, and they're all suffering in one fashion or another. There are 3 other hospitals that we're going to join with Mercy. You may have heard about last year that we're looking at kind of a merger and hope that a hospital transformation bill would get passed that might assist that. The legislature didn't get that done in the in the 4-day spring session, in the midst of the pandemic. But there is hope that the hospital transformation bill will come up in the veto session. I'm very hopeful that it will, and I think that might be of assistance certainly to the other institutions and perhaps to Mercy as well.
One more. Is there an update on McCormick Place? What's the status? Is that going to remain a possible emergency hospital should it get difficult this fall and winter?
It's not now a likely location for us to transfer people to. Remember that in the midst of the worst parts of this pandemic, for Illinois anyway, our concern was that the numbers would just go through the roof. In fact, we had some projections that we were able to avoid because of the quick action by both the city and the state. But I'm concerned about us getting back to something like that. But McCormick Place isn't currently a location that we would send people to if we got to some situation where the hospitals are full. We're monitoring that, as you know, the hospital bed situation, availability situation in every hospital all across the state. And we're in a decent position right now. But again, we have to keep our positivity rates down and our infection rates down so that we don't have an increase. Because here's the thing I want everybody to pay attention to. When the numbers start to go up, even if people say, well, gee, that's only a linear change and it's not that much and it's point something. Well, it was only a small amount for an extended period of time that ultimately led Texas and Arizona and Florida to be in the terrible situations that they were just a month ago and before. And we don't want to get there. And that's why we have to keep pushing the numbers down so that we can avoid something like that and we can avoid ever using something like the McCormick Place. Right now, we have an alternative site that's available in the Chicago area, and we're going to maintain that even though we don't anticipate right now, based upon where we are right now, that we'll be there. But this virus is unpredictable.
Where's that site and how many beds?
It's the, I forget which, Metro South, thank you, yeah, because we had 3 before. Metro South, yeah.
Governor Whitmer and the governor of Louisiana just allowed all fall sports to be played. Is there any chance that could happen here? We're the only state in the Midwest that doesn't have all fall sports.
We certainly would have to have our positivity rates come down significantly.
All right, thank you.